Hello, this is Brandon Carter. This is Health and Physical Assessment, Nursing 355, University of Louisiana, Lafayette. Hello, this is Brandon Carter again. Today I'm here with...
I'm Anthony.
Anthony, can you tell me the reason for your visit?
I'm here for a physical for work.
Physical for work, that's good. Okay. Well, first thing I want to ask you a question. Are there any history of any diseases with you going on? Like, let's just say heart disease?
No.
Peripheral vascular disease?
No.
What about diabetes?
No.
Any history of heart attacks in your family?
No, none that I'm aware of.
None that you're aware of. Okay. Well, have you been experiencing any abdominal pain, back pain, or any flank pain, which is on the sides here?
No.
Okay. Have you noticed any coldness in your hands and fingertips?
No.
Okay. And have you noticed any swelling in your legs in the past week or anything?
No.
Okay. Good. Well, good. I like to mark that off. Just mark it off. Make sure that I have all my information. Okay. Well, first thing I could do for you today is I want to do, due to time constraints, I want to do a inspection and an assessment of your heart and your great vessels. Okay.
All right.
So what I can have you do right now is I want you to lay down on this couch here, this comfortable exam room. We're being very organic here. Well, let me have you move up a little bit more so that way you're 30 degrees. I designed this so it's 30 degrees there. Good job. Okay, the first thing I want to do is look at your jugular veins, okay? So what I'm going to have you do is, since you're sitting on your right side, since I'm exposed to your right side, go ahead and look left here. Okay? The first thing I want to do is find it and locate it. So I'm going to use a flashlight to locate it. As you see here, this space is this structure you see right here is called a sternocleidomastoid muscle. And in there, your external jugular vein would be towards the outside of that, and towards the inside, what we call medial, would be what they call your internal jugular. And what I'm looking for is a pulsation. So camera, will you come close that I could point out those? And as you see here, it'll be located right here, along with the EJ, external jugular, right here. Okay, now let's look on your left side, and that was your right side. Let's move to your left. Let me have you look towards your right and look up just a little bit. Thank you. Thank you, Anthony. Are you feeling any pain when I do that?
No.
Okay. So the first thing I want to do, find your sternocleidomastoid, and I want to look towards the inner part and look for a sort of pulsating movement here, which will indicate your internal jugular and your external. Okay, go ahead and look forward for me. Next thing I want to do is take a look at your carotid pulses. Okay.
All right.
So your carotid pulses be right here on your neck. What I don't want to do is check them both at the same time. Using the pads of my fingers, which will be my middle and my index, I'm just going to feel for your carotid pulse. And when I'm feeling for your carotid pulse, what I want to do is feel the contour and the amplitude of it. And here on your right side, I feel it. It feels fine. Any pain when I do that?
No.
Okay, I'm going to move towards the left. And camera, will you come in a little bit? And I'm feeling the same. Any pain?
No.
Okay, let me show the camera for the right side again. Any pain?
No.
Okay, good job. Next thing I want to do is look at your chest. I want to inspect your chest, okay? So first, what I want to do is I'm going to have to undrape your gown just so I can see that part. And what we're going to do is a precordial inspection. And with that precordial inspection, I'm going to look for any lifts, heaves, and I want to feel for some thrills, okay? So right now I'm going to lower your gown just to the sides I need, okay? And what I want to do is I want to feel the second intercostal space. So from the clavicle, I go 1, 2 on the right sternal border, okay? And what I want to feel is for any thrills, okay? And I'm just going to palpate. On the opposite side, the left sternal porter, and the second intercostal space. I'm going to go down to third intercostal space, fourth and fifth, and fill there. Then I'm going to take it to the fifth intercostal space, and what I want to feel here is for your apical pulse, okay? And it will also called the PMI, the point of maximum impulse. Now I just want to feel that for a second. I want to locate it, okay? And all right. Another thing I want to do is feel for any thrills. Now, are you having any chest pain?
No.
Okay. Now, have you had any history of chest pain, cardiac disease?
No, none.
Anybody in your family?
No.
Okay. Good job. Next thing I want to do is make sure we see him no lifts, no heaves, no thrills. So you're not having any trouble with your heart right now?
No.
Okay. Well, now I want to take a listen, okay? Using the diaphragm of my stethoscope, I'm going to listen to certain areas of your heart, okay? Where your arteries will be, okay? So the first one I want to listen to is your aortic area, which is in the second intercostal space. So 1, 2. Now I want to listen to your pulmonic, which is opposite on your left, second intercostal space. Now to listen to your tricuspid, I'm going to go to the third, fourth, and the fifth. In between there, and listen to your tricuspid area. Now I want to listen to your mitral. And what that is doing is representing your left ventricle, okay? Now I want to listen to, like I said, your PMI point, which is your apical pulse, but I'm going to use that using what they call the bell of my stethoscope. So let me locate it first. 1, 2, and there's the second, third, fourth, and fifth. Also always using my index and my middle finger and the pads of my finger. If you have any pain, you just let me know.
Alright.
Alright, now I found my apical pulse. I'm going to put my bell of my stethoscope. And I use my bell of my stethoscope to listen to faint sounds. If I have a hard trouble listening to it, I'm going to ask the patient to exhale. And now hold your breath. I'm listening for the impulse and listening for any sternal rubbing. I'm listening also while I'm doing this, and I'm auscultating. I'm listening for S3 abnormal heart sounds, as in S3 and S4 gallop sounds. And I'm listening for any heart abnormalities, heart murmurs, anything that can be found on Anthony or any other patient. Now, thank you, Anthony. Next thing I want to do, and you do sound well. You sound very good. I don't see any problems to worry about in your heart area. Next, I'm going to look at your pulses, okay? In what they call your peripheral vascular system. So what I'll do is I'll start on your right side and your left side and work all the way down to your feet, okay? But first I want to do is look at your hands. I want to inspect his hands for any coldness, any blueness, any cyanosis, any clubbing on both sides. And his hands seem to be fine. Also, I want to look for symmetry in the arm. Make sure there's no cyanosis, no hair loss due to lack of blood flow. So now, and they look fine. So now I want to do is I want to palpate and test and look for your pulses, okay? The first one I want to do is on your right hand. I'm going to do your brachial artery, okay? And check that pulse there. I'm going to just lift your gown up here, okay?
Alright.
Alright. So, and it should be towards, okay, this is the forearm. This is your antecubital. So it should be in this area, which I found located. Good. Okay. Also, I'm going to go to his left arm. And I just want to compare for symmetry. They seem to be symmetric, and they shouldn't. I don't see no abnormalities. Now the second one I want to feel is your radial pulses, okay? Which is the radial is next to his thumb, and your radial artery should feel that. Also on your right side, I want to compare next to your thumb. Perfect. All right. Any pain when I did that?
No.
Okay. Any history in your family of peripheral vascular disease?
No, not that I know of.
Okay, good. Also, now I'm going to check his ulnar, which is opposite side, contralateral to his radial, and you feel that impulse. And then any pain when I do this?
No.
All right, I'll check your left side. Good. Okay. Next, I want to inspect your lower extremities, okay, which are your legs and your feet. First thing I want to do is I want to look at the size and the shape. As I see right now, they're both equal, which means they're symmetrical. Also, I notice your hair distribution is the same. You have no hair loss due to lack of blood flow. I don't see no scars, no ulcers, okay? Have you found any coldness in your feet or tingling lately?
No.
Okay, can you move on your feet? Okay, and then I will check the soles of your feet and make sure there's no scars or ulcers. Now that I've inspected and I notice there's symmetry, any pain when I touched you?
No.
Okay, what I want to do is check the pulses in your lower extremities, okay? Right. First thing I want to do is check the popliteal arteries, okay? So I'm going to just have you bend your legs just a little bit, because what I want to do is get behind your legs using the pads of my fingers and look for this artery. I want to feel your pulsation, okay? And as I feel on this side, it feels normal. What we will call 2+ pulsation, normal. Anything higher would be a 3+, would be a bounding pulse, will indicate some type of high blood pressure, okay? Also here, on your left side, which was your right side first, your left side, same thing, and they feel symmetrical, 2+. As I'm noticing, he has, as I'm touching him, there's no warmth, no swelling. Have you had any history of a deep vein thrombosis, also known as a DVT?
No.
Okay, good. DVTs are something we have to look for. Just in case if dislodged, they can end up to be a pulmonary embolism, which can be fatal. Okay, Anthony. Also, next one I want to look at is I'm just feeling your legs down, and your feet do feel warm, and the color seems normal, so it indicates that you have no problems with your vascularity in your lower extremities, which means your blood flow. Also, I want to feel your dorsopedis arteries, okay? So what I'll do is I'll start on your feet and work my way towards, feel the bounding. Right here, I found it right away. On your right side, good. And on your left side. Okay. Very symmetrical. Any pain when I do that?
No.
Okay. Now I want to feel your posterior tibialis, which is medial of your foot, in the back, which what we call posterior. Feel your artery, okay? Located here. Located here. And again, good pulses. I'll say 2+, which indicates normal. You have good color towards the bottom of your feet. You have good movement, good hair distribution. So, Anthony, I see no problems. Go ahead and get up for me. And now, did you feel faint when you got up?
No.
Okay, good. That means you have good blood flow through your body. Well, thank you for letting me inspect you, and I'll give your results to the doctor.
All right. Thank you.